So with a fecal transplant, you're basically taking poop from one person and you're giving it to another.
Correct. It's a messy business.
Dr. Sabine Hazan is an expert in the field of gut health and microbiome research. Her book, Let's Talk SHIT, is an easy-to-digest explanation of the human microbiome.
The future is in poop. The importance of gut health, which is really your immunity, is in the gut.
In this episode, she breaks down the FDA's recent approval of the use of fecal transplants for research into the treatment of autism.
It's going to be an important study to give us data onto whether siblings that are neurotypical can be a good donor for the kid that's autistic.
We also discuss the relationship between the COVID-19 spike protein and the microbiome, how people who got severe COVID lack a certain critical gut bacteria, and the need for precise microbiome research to develop effective treatments.
If anything we've learned from COVID is the importance of microbes that can kill us, but also microbes that can save us.
This is American Thought Leaders, and I'm Yanya Kellick. Dr. Sabine Hazan, such a pleasure to have you back on American Thought Leaders.
Thank you for having me.
So there's some news hot off the presses, very relevant to your work. We have the FDA approving familial fecal transplants for research purposes. I mean, this is kind of a game changer. And the only reason I know it's a game changer is because we've talked in the past and have kept talking. And the other thing is you have this study where you helped some twins, autistic twins, get better. And so I want to talk about both these things and then the whole bigger picture. What's going on with this FDA approval now? How is that going to change everything?
It's going to at least allow us to do the proper research. This is not a pharmaceutical product. This is using the stools of a healthy sibling into a kid that is autistic. And it is also looking at if the kid that is neurotypical has the same microbes of the kid that has autism, and therefore kind of decide, do we want to use that or not? So this is going to be a research that's going to give us some answers onto autism, hopefully, and also a research that's going to allow us to say, why isn't it working if it's not working? Why is one kid neurotypical and the other one is autistic? To be able to compare it, because kids share microbes, families share microbes. And so that's kind of like, what I want to see with this study.
Well, so let's break all this down, okay? There's multiple elements here. Autism, it's this multifactorial disease as best as I understand it at the moment. And of course, the HHS has this deep interest in tackling it because the rates have been going up, and that's kind of, I guess, incontrovertible at this point. The question is why, and this directly targets that. The other part that I think you're speaking to here is that people are different, and sort of one-size-fits-all policies for medical care just don't work. And this is one of the lessons we had during the pandemic, that you need to treat look at each patient individually when it comes to microbiome, when it comes to their genetics, all sorts of things. So let's unpack all this for me.
Yeah. So, I think to unpack it, you kind of have to go back to the history of what happened, right? How did we get to this? What is the microbiome? How does FDA look at the microbiome, et cetera? So if you think about the microbiome, it's basically microbes in your gut, right? We describe the microbiome of the gut, but there's microbes all around us. If anything we've learned from COVID is the importance of microbes that can kill us, but also microbes that can save us. And the importance of gut health, which is really your immunity, is in the gut.
I just wanted to kind of break this down for the uninitiated, right? I mean, basically, so with a fecal transplant, you're basically taking poop from one person and you're giving it to another.
Correct. It's a messy business.
Right. It's a messy business, but you're taking sort of what you believe to be a healthy poop.
Right.
And you're giving it to someone who has a problem, and would see it if it was an obvious, very clear problem, and that there's no drug that will help them. That's how it started.
So when I was doing it for C. diff, the only way in America to do fecal transplant is for C. diff. So remember, it took 62 years for fecal transplant to be part of the guidelines. Of course, COVID was in the midst of all that, where the FDA said, hold off on fecal transplant because we discovered COVID in the stools, and therefore we could pass stools with COVID to the patient with the immunosuppressed or the autistic kid or whoever.
Well, just as as you said, right? You simply couldn't do these studies before.
Couldn't
basically.
do it. No. And what changed, I think this administration is a little bit more efficient in the processing of the paperwork. I would hate to think politics have something to do with treating kids with autism, because kids with autism affects both the Democrats and the Republican and the independents. It affects all races, it affects all religions, it affects boys and girls. So to make it a political agenda is really not okay. When you look at 1 in 12.5 boys in California have autism, you got to pay attention. You got to put all hands on deck and say, what are we doing here? How do we do it? And this is an amazing study because this is a physician-initiated IND, investigative new drug, that's basically, as a physician, I'm going to be looking at these kids, every single one of these kids, and say, why did it work in this kid? Why didn't it work in that kid? And what can I do to that kid that it didn't work? Because I'm not going to wait, for something else. This is where it happens. It happens on the front line of clinical trials, where as a physician, you have the courage to try different things. I'm focusing on the microbiome and an answer with fecal transplant, possibly. But what about the kid that doesn't have a microbiome abnormality and has a neurological primary? Or what about the kid that has a inflammatory bowel disease where his colonic mucosa is completely, destroyed and we need to fix that before we start implanting microbes? What about the kid that has a connection between the brain and the gut? What about the kid that has a genetic problem? These are different ways to treat.
You had been doing work around microbiome and COVID-19,
right?
The virus, and then also what happened after mRNA vaccination, and this had profound effects on the microbiome. And maybe you can kind of remind us of what you discovered,
yes,
and maybe sort of bring us to the current stage where we're at.
So remember, I was the girl that basically was doing clinical trials for pharma, and I was doing fecal transplant. The first thing that came to me during COVID was, I bet you it's in the stools. Why? Because we noticed when we were doing stool analysis that if you have a person that has a nasal congestion and is growing a microbe in the nose or in the sinuses, you will find that microbe in the sinuses. We were taking patients that had COVID, doing a nasal swab positive, and we were finding COVID in the stools. We found COVID in the stools in 100% of patients that were positive nasal swab. What we then ended up figuring out is COVID can persist in the stools. And what we also ended up figuring out was that some people were asymptomatic and had COVID in their stools, but yet never had symptoms. What was the difference between those people? The difference was their bifidobacteria.
Well, I'm going to jump in because, yes, I remember early in COVID, there was some anecdotal evidence. I think it might have even been from Korea initially that people that are eating kimchi, a lot of kimchi, are doing well or not catching COVID. And then I heard something similar about sauerkraut,
yes,
which made me want to eat kimchi and sauerkraut, of course.
Yes. So. Yeah, so that was my question at the beginning, right? Mm-hmm. Those, anecdotal studies like of kimchi and sauerkraut, because obviously you can talk to people that ate sauerkraut and still got COVID. Mm-hmm. What's different between that population? Why is one person eating sauerkraut and kimchi is fine and another person not, right? So that was my biggest question. So when you start looking at the bifidobacteria, and you start looking at COVID, we noticed that 43 severe patients with COVID had 0 bifidobacteria. I'm just going to focus on bifidobacteria, not the others, because there are some people that have 0 bifidobacteria and never got COVID, because there are other microbes that came on that said, hey, bifidobacteria is low, I'm going to up this group of microbes to basically create a resilience, right? And that's something we don't really talk about, resilience, right? So again, when you look at the bifidobacteria in these 43 patients, 0, and then you look at your patients that were exposed but never got COVID, like that first family that I did, we noticed they had a lot of bifidobacteria. So bifidobacteria was really the beginning for me. It was like, I wonder if that's the microbe I need to focus to neutralize COVID, to suppress COVID. If I have a lot of good bifidobacteria, maybe I'll be fine during COVID, right? I mean, I think what I saw during the pandemic was a bunch of miracles, you know? From losing no one during the pandemic to still being standing, speaking to you today with all, you know, the controversy in my research, because, you know, here I am, the girl that brought vaccines to market, and because I showed data that the messenger RNA killed the bifidobacteria, now I'm an anti-vaxxer. So the controversy has stopped the movement of research and science. Mm-hmm. And again, we need to stop with the controversy and say, let's ask questions. That's what science is all about. Science is about asking questions and pushing that narrative and saying it's not the way it should be.
And if I may just jump in, I mean, you discovered that the spike protein reduces bifidobacteria,
Correct.
really?
Correct. So what we discovered with the vaccine is that it did kill the bifidobacteria within a month, but it persisted in killing the bifidobacteria. Because if you look at the long COVID or the vaccine injured, and we're coming out with data on that, 0 bifidobacteria across the line. So if they have 0 bifidobacteria, I know, because I've been dealing with this for 5 years now, it's very difficult once you've killed your microbiome to get back up. So these people are still at a state of loss of diversity, loss of immunity, poor immunity, and they're also at a state, remember, bifidobacteria is important in absorbing sugar. So they're not absorbing sugar. And that's one microbe that they've lost. What about the microbe that helps break down, you know, calcium to get absorption of calcium? They've destroyed that as well. So they're not absorbing calcium. What do you think happens at the cellular level in the mitochondria when you lack sugar and you lack calcium? You're missing that energy, that Krebs cycle. Your mitochondria stops working. So long COVID is really a spike protein injury. But also, when you look at these cases, they have 0 bifidobacteria, either from the treatment or the virus themselves or the spike protein. But also, some of them have remaining COVID in their stools. So we need to pay attention to that.
Dr. Hazan, we're going to take a quick break right now, and folks, we're going to be right back. And we're back with the CEO of Progenobiome, Dr. Sabine Hazan. There were some problems also with sometimes there being endotoxin in the COVID genetic vaccines and so forth. So that would be another route that there could be damage and problems. So does that factor into what you've been looking at?
There's a lot of different factors. There was the study from Kevin McKernan and Philip Buchholz that basically showed a contamination, SV40, right? That could be a possible mechanism on how this vaccine became a bifidophage too. Did it stimulate, you know, the ability to stimulate cancer cells, for example?
Are you aware of cases where, you know, you've been able to treat people with either vaccine injury or long COVID by fecal transplant?
That's something that I possibly would bring. Although I think, you know, as I was pushing, you know, there are other ways to fix, you know, something that's going to be coming in the future. You know, you always got to keep on top of the research, and research is a story that's untold. It's one experiment after another, and you discover one thing and you move on to another thing. And then others kind of bring in their opinion and validate, verify, and reproduce what you've done, right? That gets you to keep moving further.
So when it comes to, you know, the art and perhaps of refloralization, I really like this term. It's a very nice term for something that maybe doesn't look as nice if you were to kind of staring at it. But you have had this case. I know that you're still working on publishing the research where you did this with twins, and we know that, you know, the twin studies are very popular for a bunch of reasons because the genetics are identical. What happened?
So from COVID and from doing that N of 1, which took time, and then from trying to get this familial FMT, I had these kids that were basically coming in with autism. And I have a lot of patients that come to me that have tried so many things. And so this case was 2 twins with the mom flew in from Tennessee, and I basically innovated. But I said to her, I said, let me look at the microbiome. What was amazing about this case, and it's going to be a breakthrough, I don't want to say too much because it's going to be published in October at the American College of Gastro, but essentially we saw the identical, out of trillions of microbes, we saw elevation, relative abundance of microbes elevated, the same 3 phylum in both identical kids. And as we refloralized the gut, not with fecal transplant, but with methods, we basically noticed that those microbes disappeared and the good bacteria came on at the same time as speech started. So this was a breakthrough case, and it's going to be a breakthrough for the FDA once they see that, and we're going to use that. So we're going to start doing familial fecal transplant with the FDA, but we're hoping that we can bring this other method after, while we're doing familial fecal transplant to get the data to understand, because this could have been a fluke with these 2 kids, but we want to try to reproduce these 2 kids to see if we can do this for other kids. And therefore maybe run 2 protocols, one with familial FMT, fecal microbiota transplant or intestinal microbiota transplant, and then another one with this protocol to kind of see, can we do this more, safer, better, less playing with poop, because this doesn't play with poop.
Well, and the other aspect is also that, as we said at the beginning, everybody's different,
yes,
right?
yes.
And so I think this is actually kind of important. There isn't a sort of one-size-fits-all solution when it comes to this.
There isn't a microbiome. There's trillions of microbes, and like I gave you the example with the fungus, or it could be a fungal overgrowth. It could be even Dr. Feingold, who was the beginning, who basically said, let's try vancomycin, right? He said, let's try vancomycin for kids with autism. And he saw something with vancomycin. What he was seeing was a destruction of a microbiome and a suppression of microbes that secrete toxins, which decreased the aggressivity of the kid, but did not restore the speech. But at least it gave a quality of life to the family to say, hey, our kid is not banging his head on the wall. And so vancomycin got us to this level, right? But vancomycin is not a permanent solution. The solution is really to restore the gut to the way it was. And the challenge that we have is we do not know what it was before. So when you take a kid and he has a destroyed microbiome, you don't know what his fingerprint of his microbiome was before to reproduce him, right? And you're right, everybody's different, so everybody may not need the same, but we need to be more precise.
Something just kind of struck me though. If you're going to take some sort of therapy which is going to affect your gut biome, like for example, you mentioned antibiotics earlier. I don't know if it was obvious to people. You can basically nuke your gut if you use heavy antibiotics or protracted use of antibiotics. So this creates its own set of problems, like in some cases C. diff and so forth. Does it make sense to kind of, put some on ice before if you do have to go into some sort of treatment, and then maybe that might be useful in the future?
So I do that with some patients that I see have a spectacular microbiome and are super healthy. I say, you may want to save it. I saved some of mine before COVID because I knew I was going to be on the front line. I was going to be exposed to COVID, and I wanted to make sure I had my original microbiome that I could go back to because I know the genetics in my family. And I know I want to go back to my personality in a way and what I can do. So I kind of wanted that. But yes, that's the future. Again, there's red tape with that as well. You need to have a licensed lab. You need to store it properly. You need to make sure it's the right stools.
But I also think the headline here, right, the thing that you're not mentioning is that all those conditions are actually treatable by affecting the microbiome, and that's been shown, right? And I don't know if everybody understands that.
Here's the thing. When you say that, it gets the academia to go, oh my God, she's talking cures, etc. You can't really say that until you show the data, right? We have anecdotal data that shows, you know, if you look at the studies from China, they've showed improvement of Parkinson's with fecal microbiota transplant. Johns Hopkins is going to start a study on that, right? So we're at the beginning of all this. Eventually we'll go back and say, oh my God, how archaic these humans were. They were practicing, you know, they were operating on a kidney instead of like changing the microbiome, right?
But I guess we should say that there's potential in all these areas.
100%,
Very real,
yes,
very real potential.
Yes,
right. That's
yes.
and that's actually
yes.
that's what I meant. This is certainly is not something that's being broadly done or explored. Right. I understand. But the other thing that you mentioned, which I thought was really interesting, was I think you were suggesting that when your gut flora changes significantly, your personality might change significantly. I think you mentioned that, like you alluded to that a few times.
Yes, so
as we've been talking. Yeah.
So we showed data of a signature microbiome in anxiety. Remember, people were very anxious during COVID, and whether it was from the media, whether it was from, you know, whatever, the COVID itself or the treatment, people were very anxious with COVID.
So there seems to be, you know, quite a bit of open-minded thinking around health, especially preventative medicine, but of course in treatment of all sorts. And there's this huge focus on autism right now. You know, what would be your recommendations in terms of, you know, approaching the autism question through the biome, for example, or more broadly?
I mean, this is something that I'd love to work with this government to kind of start seeing, and not only this government, but probably with governments from around the world as well. Autism, like I said, affects everyone. Every country has kids with autism. If we could come together to help these kids, what a great thing that would be, you know? So I think what COVID did is it removed our trust in the agencies, removed our trust in the government, removed our trust from pharmaceutical companies. I think I'm the right person to kind of bring it all together to say, look, you want me to trust you, then let's start doing the research properly, where we look at the microbiome, where we understand these diseases properly, where we work together. As clinical trials doctor, we come together with doctors around the world. I had colleagues in Italy that were doing clinical trials. I had colleagues in Germany that were doing clinical trials. I could call Italy and say, what's been working for you? And then I could apply it for my patients and my population here in America. We need to start joining together to understand and to fix these kids. 1 in 12.5 boys in California have autism. When are we gonna start paying attention? When 1 in 1 kid is autistic? And if not now, when? And the only way to fix that is to all come together as human beings for the goodness of our children and the generations in the future.
Well, Dr. Sabine Hazan, it's such a pleasure to have had you on.
Thank you, and thank you again for having me.
Thank you all for joining Dr. Sabine Hazan and me on this episode of American Thought Leaders. I'm your host, Jan Jekielek.